Here is a patient G2P1 at 25 weeks presented with right upper quadrant pain and also one episode of seizure. Now this patient on further evaluation 7.6 gram per dl is the hemoglobin level, that means there is anemia. Anemia in presence of right upper quadrant pain make us think about hemolysis. Now also on further investigation the platelet count is around 70,000, that means there is low platelet. And also because of the right upper quadrant pain, if you see that this patient's liver enzymes, they will be elevated, so elevated liver enzymes. Also this patient has one episode of seizure, that means this patient might be having preeclampsia or eclampsia. This patient might be having eclampsia. So this all points actually direct us towards HELP syndrome, hemolysis, elevated liver enzyme and low platelet is HELP syndrome. Okay, the most common cause of maternal mortality in HELP syndrome is abruptio or DIC. Please remember, in this case the question is asking about definitive management in 25 weeks of pregnant female is termination of pregnancy. So let us talk about HELP syndrome in a short. So the HELP syndrome is seen basically in 27 to 37 weeks. So within this 27 to 37 weeks of period, the most common cause of maternal death is abruptio or DIC. As I told you, a PT-INR will be normal, but if the DIC is developed, then in that case it might get worsened. Diagnosis is HELP syndrome. I told you, hemolysis, elevated liver enzymes and low platelet count. Low platelet count is actually, it is less than 1 lakh per microliter. And elevated liver enzymes means it should be more than the double of the upper limit of normal. That is around 45 is the normal. So more than 70 is what is the diagnostic criteria saying. Another is hemolysis. How will you establish the hemolysis? Now hemolysis, to establish, you need to establish presence of cystocytes in the peripheral blood smear, or you have to assess the serum bilirubin and it should be more than 1.2 milligram per dl. Okay, or there may be low haptoglobin, or there may be elevated LDH. Elevated LDH should be more than equals to 600 international unit per dl. Okay, so if also there is another criteria, that is severe anemia unrelated to blood loss. So within this 4, at least 2 should be present to document it as a case of hemolysis. And hemolysis, elevated liver enzyme, platelet count low, these three have to be present to diagnose it as HELP syndrome. This is what is Tenace's criteria. Now how do you manage this case is administer prophylactic Magsulf. Administer prophylactic Magsulf and treat the severe hypertension so that these things does not get worsened. The definitive management, you have to do termination of pregnancy immediately, and that was the question asking. So we divide if the patient is less than 34 weeks or more than 34 weeks. Okay, if it is more than equals to 34 weeks, then we can directly go for termination of pregnancy after stabilizing the mother. So we first have to stabilize the mother and then we have to deliver it. Okay, and if the pregnancy is less than 34 weeks, in that case we have to give first dose of steroid. So give the first dose of steroid and then deliver the baby without waiting for the second dose of the steroid. Now please remember, in 80% of patients with HELP syndrome the BP is increased. Okay, and that might complicate the HELP syndrome. Here is the case, but 20% of patients might be having a normal BP. So thank you.